Hello, everyone. It is an honor to be here today, and I'm grateful to speak to you on behalf of AesculaTech. My name is Adam Griese, and as the Director of Medical Products, I will be telling you about our new treatment for dry eyes. We know that at least 12 million patients in the US suffer from moderate to severe dry eye disease. These are people who can't get relief from lubricating drops alone. They also have to rely on second-line treatments. Unfortunately, dry eye itself is a pathologically challenging disease, and those treatments are far from perfect. Clearly, there is room to enhance the doctor's toolbox with simple, reliable treatments that work. This is exactly what AesculaTech has set out to do. At AesculaTech, we engineer smart materials, like the one you see in this looping video. This hydrogel illustrates a very interesting behavior. At room temperature, it's a clear liquid, but at body temperature, it is an opaque, flexible solid. Humidify is a novel system that improves tear availability on the eye by occluding the tear duct using this special gel. Historically, devices that occlude the tear duct and perform the similar function are quite effective, but also very problematic. Humidify will be the optimal solution for occluding the tear duct because it combines this smart material with a custom auto-injector. And that auto-injector looks like this. The system is fast, safe, and easy to use, delivering just 5 microliters of hydrogel at the press of a button. Now, let me show you how these features make Humidify a unique solution for treating dry eye disease. In this next animation, you will see the dispensing cannula entering the tear duct to a fixed depth. It goes in, nice and easy, the button is pressed, the gel flows out, it adapts, and it becomes a custom-fitting occlusion, which requires no sizing for each patient, all done in 3 minutes or less bilaterally. So that's a theory. Let's see how this looks in practice. Our team conducted a clinical feasibility study in 44 eyes of 22 patients over 3 months. On the right, you're going to see a video of our investigator demonstrating the insertion process. You can see that his preferred practice is to apply some topical anesthetic to the punctum, which is the entry to the tear duct, using a cotton swab, and then to widen the punctum using the provided dilator. I'd like you to note that during this process, the patient is not blinking vigorously, she's not in distress, there's no discomfort issues. Next, he's going to expose the cannula, which is small enough to fit into just about any punctum without the need for dilation, and also entering to a fixed depth based on the geometry of the device. He'll press the button, and the procedure is done, all in around 40 seconds. When it's time to remove the device, the special, unique properties of that hydrogel allow it to be easily flushed out with standard, gentle saline irrigation. That's the procedure. The patients felt it was well tolerated, and the investigator loved how fast and easy it was. Now let me show you why the patients really loved it. We collected sign and symptom data focusing on ocular surface disease index, which is a validated scale for describing the quality of life in patients with dry eye disease, and the NEI grading of corneal fluorescein staining, which uses a special dye to highlight areas of cell damage on the eye as these bright spots. Both signs and symptoms, as you can see from the chart, are quite severe at baseline, but experienced a significant decrease at just 2 weeks. That result was enhanced and sustained through 3 months, resulting in symptoms which, at the end of the study, were on average mild or normal like you or I might have. This result was complemented by a similarly dramatic change to the physical elements of the ocular surface, which is illustrated by the corneal image you see in the bottom right of the screen. This shows the same eye at baseline and at the end of the treatment. You can tell that all those bright spots in the baseline eye indicating cell damage on the eye are simply no longer present at 3 months after treatment. This is the power of sustained natural lubrication on the ocular surface. That lubrication and cellular healing also had a profound effect on the patient vision. The best corrected logMAR score for visual acuity was improved by over 75% in these patients. Now, I know there's kind of a lot of very curious, interesting data to get into here and digest in a short time. So if you'd like a closer look, I'll refer you to the 2 abstracts published through ARVO earlier this year. So we have this well-tolerated procedure and those impressive clinical outcomes, which lead directly to patient satisfaction, as you can see from the 2 near-perfect satisfaction scores, both for humidify insertion comfort and for 3-month wear of the treatment. Every patient reported improved quality of life. We even heard anecdotes about, even though they couldn't feel it at all, they could feel it working. All of this leads us to say that humidify will have a significant impact on the landscape of dry eye management. Patients can count on a comfortable treatment that is fast and will provide them with a custom fitting occlusion for rapid, sustained improvement of both dry eye signs and symptoms. Aside from happy patients, clinicians will benefit from a treatment that is very fast and efficient, very inventory efficient, and well reimbursed with standard CPT coding. As of this quarter, humidify has been approved by the FDA for an IDE pivotal study. In summary, humidify is an innovative treatment that will soon be available to make a difference in doctors' practice and for their patients. My name is Adam Griese. If you have any questions or would like to learn more, please find me later. Thank you for your time.